Unlocking techniques of energy channels. Bandhas play a significant role in the spiritual development of a yogi. The Bandha group consists of three Bandhas, Mula, Uddiyana and Jalandhar Bandhas. The fourth, Mahabandha, is a combination of all the three Bandhas. The mastery of these bandhas is considered equal to or of greater importance than the hundreds of asanas, pranayams and mudra practices. In the tradition, these highly respected bandhas are secretly introduced to a spiritual aspirant only after he gets mastery over the asanas, pranayams and mudras. These energy locks literally open the energy centers of the aspirant when practiced under the guidance of a proficient yoga teacher or a yogi. Bandhas can be compared to damming a river. Though the modern yogic literature define bandhas as locks, they are essentially unlocking the energy channels. It is the technique of locking or contracting certain muscles on physical level by which a subtle process of unlocking takes place on pranic and mental levels. According to most modern relaxation therapies, by the total systematic contraction and relaxation of muscles all over the body, one would regain the physical and mental relaxation. In order to remove the tension from the physical and mental layers, one has to exaggerate the tension already existing in the body by willfully and selectively contracting the muscles. This is the logic behind these theories. Bandhas to work in a similar way. As they are associated with the energy centers in the spine and brain, they affect physical, pranic, mental, psychic and causal bodies of the human system. First is Mula Bandha, root energy lock. Pressing the perineum vagina with the heel and contracting the rectum so that the Apna Vayu moves upward is defined as Mula Bandha. Hatha Yoga Pradipika 61, Technique 1. There are two phases of practicing Mula Bandha. Phase 1. Sit in Siddha Siddha Yoni Asana so that pressure is applied to the perineal vaginal region. Close the eyes and relax the whole body. Concentrate on the natural breath for a short while. Then focus the awareness on the perineal vaginal region. Contract this region by pulling up on the muscles of the pelvic floor and then relaxing them. Continue to briefly contract and relax the perineal vaginal region as rhythmically and evenly as possible. Phase 2. Slowly contract this region and hold the contraction. Continue to breathe normally, do not hold the breath. Be totally aware of the physical sensation. Contract a little tighter, but keep the rest of the body relaxed. Contract only those muscles related to Mooladhara region. In the beginning, the anal and urinary sphincters also contract, but as greater awareness and control is developed, this will be minimized and eventually it will cease. Ultimately, the practitioner will feel one point of movement against the heel. Relax the muscles slowly and evenly. Adjust the tension in the spine to help focus on the point of contraction. Repeat the practice 10 times with maximum contraction and total relaxation. Technique 2. Sit in any comfortable meditative posture, i.e. Siddha Siddha Yoni Asana where knees firmly touch the floor. You can also adapt Mula Bandhasana which press the heel into the perineum and help to improve the performance of the Mula Bandha. Place the palms on the knees. Close the eyes and relax the whole body for few minutes. Inhale deeply, retain the breath inside and perform Jalandhar Bandha. While maintaining Jalandhar Bandha, perform Mula Bandha by slowly contracting the perineal vaginal region and holding the contraction as tightly as possible. Do not strain yourself. Hold the final position for as long as possible. Slowly release the Mula Bandha, raise the head to the upright position and exhale. Repeat the practice up to 10 times. Notes: Mula Bandha is the contraction of certain muscles in the pelvic floor. It does not contract the whole perineum. In the male body, the area of contraction lies between the anus and testes. In the female body, the point of contraction is behind the cervix, where the uterus projects into the vagina. Perform the practice of Mula Bandha under the guidance of an experienced yoga teacher. This practice raises the energies very fast and thus can precipitate symptoms of hyperactivity if wrongly practiced or practiced without sufficient preliminary preparation. Benefits of Mula Bandha: it stimulates the pelvic nerves and tones the urogenital and excretory systems. Intestinal peristalsis is also stimulated, relieving constipation and piles. It is also beneficial for anal fissures, ulcers, prostatitis, some cases of prostatic hypertrophy and chronic pelvic infections. Because it releases energy, it is also effective in treatment of psychosomatic and some degenerative illness. Mula Bandha helps in attaining sexual control and to alleviate a multitude of sexual disorders. It helps to relieve sexual frustration, suppression of sexual energy and feelings of sexual guilt. Second is Uddiyana Bandha, abdomen energy lock. Uddiyana Bandha is so called by the yogis because through its practice, the prana is concentrated at one point and rises through Sushumna. Hatha Yoga Pradipika 55, practice. Sit in Siddha Siddha Yoni Asana or Padmasana with the spine erect and the knees in contact with the floor. A cushion may be used so that the buttocks are raised, lowering the knees. Place the palms flat on the knees. Close your eyes and relax the entire body. Breathe deeply and slowly through both the nostrils. Exhale through the mouth with a whoosh, emptying the lungs as much as possible. Hold the breath outside. Lean forward and press down on the knees with the palms. Straighten the elbows and raise the shoulders, allowing further extension of the spinal cord. Do spontaneous Jalandhar Bandha, pressing the chin against the chest. Contract the abdominal muscles inward and upward. Hold the abdominal lock and the breath outside for as long as you can without straining. Then release the abdominal lock, bend the elbows and lower the shoulders. Raise the head and then slowly inhale. Remain in the same position till the respiration returns to normal, and then begin the next round of practice. Notes: you can start this practice with 3 rounds in the beginning and gradually increase it to 10 rounds over for a few months as you become accustomed to the practice. This bandha is easier to practice if preceded by an inverted asana. Contraindications: persons suffering from colitis, stomach or intestinal ulcer, diaphragmatic hernia, high blood pressure, heart disease, glaucoma and raised intracranial pressure should not perform this practice. Benefits of Uddiyana Bandha: Uddiyana Bandha is the panacea for many abdominal and stomach ailments, including constipation, indigestion, worms and diabetes, provided they are not chronic. The digestive fire is stimulated and the abdominal organs are all massaged and toned. The adrenal glands are balanced, removing lethargy and soothing anxiety and tension. It improves the blood circulation to the whole trunk area and strengthens all the internal organs. Uddiyana Bandha also stimulates the solar plexus, which has many subtle influences on the distribution of energy throughout the body. Third is Jalandhar Bandha, chin lock. Contracting the throat by bringing the chin to the chest is the bandha or lock called as Jalandhar Bandha. It destroys the old age and death. Hatha Yoga Pradipika 70, practice. Sit in Padmasana, lotus pose, or Siddha Siddhayoni Asana with the head and spine straight. The knees should be in firm contact with the floor. Those who cannot manage this position can practice Jalandhar Bandha in a standing position. Place the palms of the hands on the knees. Close your eyes and relax the whole body. Inhale slowly, deeply and retain the breath inside. While retaining the breath, bend the head forward and press the chin tightly against the chin. Straighten the arms and lock them firmly into position, pressing the knees down with the hands. Simultaneously, hunch the shoulders upwards and forward. This will ensure that the arms stay locked, thus intensifying the pressure applied to the neck. Stay in the final position for as long as the breath can be held comfortably. Do not strain yourself. Relax your shoulders, bend the arms, slowly release the lock, and raise the head and then exhale. Repeat the procedure when the respiration has returned to normal. Notes: this practice should be practiced for as long as you are able to comfortably retain the breath. You can gradually increase the period by maintaining a count while retaining the breath and increasing the count one by one. Do not inhale or exhale until the chin lock and arm lock have been released and the head is fully upright. If any sensation of suffocation is experienced, immediately stop and relax. Once the sensation has passed, you can resume the practice. This practice can also be performed with external breath retention. Jalandhar Bandha, if practiced on its own, should be performed after asanas and pranayams and before meditation. Contraindications: people suffering from cervical spondylitis, high intracranial pressure, vertigo, high blood pressure or heart disease should not practice Jalandhar Bandha. Even though it reduces the blood pressure initially, long retention of the breath brings about some strain on the heart. Benefits of Jalandhar Bandha: physical benefits. The practice compresses the carotid sinuses, which are located on the carotid arteries, the main arteries in the neck. These sinuses help to regulate the circulatory and respiratory systems. The stimulus on the throat helps to balance the thyroid function and regulate the metabolism. Psychological benefits: it produces mental relaxation, relieving stress, anxiety and anger. It also develops meditative introversion and one-pointedness.